Of course, as we observe Men's Mental Health Awareness Month, we look into raising awareness and also just breaking down the stigmas surrounding men's mental health and also their emotional well-being. We delve into difficulties that lead men into mental illnesses, resulting in high numbers of deaths by suicide, substance abuse, family breakups, and also what makes it difficult for them to speak up and also just seek help in time. To unpack this and more, we're going to be joined by Deputy Director of the South African Federation for Mental Health, Leon de Beer, who's also walked, miles of his own in dealing with mental illness at large. And not only will we be discussing his personal journey, but also just reflect and talk about the role that the organization is playing in society at large. And so on that note, Leon, a very good afternoon and thank you. Thank you for your vulnerability and thank you for your time and thank you for the important work that is being done. Just before we went live, I was speaking about the crisis that we're in relation to men's mental health and really what is coming to the fore. Tell us what are the narratives and the perceptions around masculinity and social norms that's enabling this crisis?
Yeah, as I was saying to you, hello. Sorry to start off with hello
Sure.
to everybody. It's great to be here, and it's wonderful being here on Father's Day. I just want to say that it's a very important occasion for us to be having this discussion because, lots of us men are fathers, and to be good fathers who carry and who pass on good intergenerational mental health, it's important that we also talk to families about men's mental health. So I just wanted to note that.
Yeah.
I think the problems we have around men's mental health is really that societies tend to expect a lot from its men. We grow up with these kind of, there's the masculinity norms that are kind of instilled in men, but the societal stereotypes that say, men need to be in control, they need to be decision makers, display confidence, provide a decisive voice of reason and rationale. Men are often portrayed as the steady hand, the rock in times of trouble and uncertainty, providers, protectors, fearless. We need to be dependable and confident. But the sad irony in all that is that actually those very traits that are placed upon men can lead to men feeling emasculated and inadequate, because if you don't live up to all those expectations, and very few men really do in reality, which is why we sit with such a pandemic. And it's just not realistic to expect that men should always be the stronger ones and abide by these societal mottos of what makes a man. We should always pull ourselves together and all those kind of things.
Yeah, absolutely. You're speaking about the stereotypes and the expectations, but even in a South African context, it's important to note the social constructs, the political constructs, the economic constructs that we exist in, and the backdrop of that, what impact that has. But even if we're mitigating against triple threats of poverty, unemployment, and inequality, that's further fuel to the fire.
Yeah, absolutely. We're not even talking about the socio-economic factors and all those things, because it does impact on men, especially, when we think about that role of the provider.
Yes.
I was doing an interview with somebody last week where they asked me about the same thing and about, the financial, what are the financial drivers or impacts on men when we look at mental health. And I think it's really about that thing about having to be the provider and, so having to maintain employment no matter what, even if you're falling apart, you can't be the one that crumbles, because you have to, if you come from a family and an environment where you are expected to be the breadwinner or the one that kind of safeguards the family financially, it places immense stress on a man. And if you don't cope, like I said earlier, in fact, those stereotypes and those stigmas actually just make it worse. And then if you do end up, having a breakdown or something, and you end up in hospital, or you lose your job, then you plunge into poverty, which Poverty and mental health is a whole different conversation we can talk about for an hour, because there's a chicken and an egg relationship between the two. But so many factors to consider in our country.
Absolutely, Leon. I actually even want to go to, as it's been dubbed, the silent pandemic, because that's also intricately linked to the rates of suicide. It's alarming at this point. To unpack that a little bit more for us, even the microaggressions and the silences that come with upholding, that image as well.
So I think when we talk about, we can't talk about men and mental health if we don't talk about suicide. And suicide is never a nice topic to talk about. But, research has shown us that globally, we look at about 1 million suicide-related deaths a year. 75% of that is men. So out of 1 million suicides, 750,000 of those are men, which is just absolutely staggering. And there's a story. And the silence you're referring to is very, very pertinent. It's a very important part of this discussion, because what happens is men who, for instance, start feeling depressed, and many start struggling with depression because of these societal stereotypes. And they, men have been shown globally to have very bad help-seeking behavior, which is often perpetuated by these societal stereotypes. So what happens? A man starts developing depression. He doesn't want to go for treatment because otherwise he's going to be seen as weak. One of the big issues is also that depression in men often looks different than what we think about when we think about traditional depression symptoms. So when you and I, if we talk about depression, we think about low mood, feeling sad, not having energy. And actually in men, it can be the polar opposite. In men, depression can manifest as aggression, irritability, anger. So what happens, the diagnosis of depression either gets missed, or families don't recognize that a male is suffering or living with depression, or they don't go look for help. So there are all these things kind of working together to create this silent pandemic. And it is silent because men keep silent, they don't get the help they need, and unfortunately many men end up dying by suicide.
Yeah, and Leon, just to also personalize the story, I did mention earlier on that we were going to bring it back home to you, and you were, comfortable sharing your own story, perhaps in empowering others. You dealt with depression. You also had to face your anxieties. Tell us a little bit more about your journey. What transpired? How are you coping to this day?
Yeah. So, when I was thinking about talking to you today, I was reflecting back, and I think anxiety and depression were probably lying dormant in me as a human being anyway, like two opportunistic thieves in the night, kind of waiting to pounce. And then around 2015, 2016, I went through a very big life-changing kind of traumatic time in my life, and that is when it really triggered. And it has been a difficult journey, but luckily I managed to get the right regime of treatment and support in place early enough to help me cope with it. So, overall, I'm fine. I've been the Deputy Director of the South African Federation for Mental Health for 13 years now. I'm a proud husband. I've got 2 beautiful daughters. So I cope with life, but sometimes life throws you a curveball. For instance, I lost my mum to cancer earlier this year, and then it knocks you back. Anybody would get knocked back. But I guess for somebody who does have that predisposition to anxiety and depression, it does knock you back. And it's just about getting back on that horse and making sure that, you stick to your treatment, you focus on your well-being. Support systems, I can't talk enough about, and this, again, I just want to take it back to the wider conversation around men and mental health, which is why it's so important that we have these conversations, is that without a strong support system around you, or if I take myself as an example, if I didn't have a family environment around me, a work environment that supported me, the rest of the treatment, like therapy and medication, all those things, wouldn't have helped as much as it did. So it is really about ensuring that you get that comprehensive wraparound basket of services and support around you to help you on your journey.
Yeah, well, Leon, thank you for your vulnerability and for sharing your story and for weighing in also the work that you do. We're going to leave the conversation there, but of course it continues. This perhaps can serve as a conversation starter for many more other aspects that need to be, unpacked in relation to men's mental health. But for now, let's leave it there. Leon de Beer, Deputy Director of SA Federation for Mental Health, weighing in.